I think I've got about 5 or 6 slides, and I'm only going to use about 2 or 3 because I'm really boring, and the networking bit is fantastic, and I think you should be out there doing that because I've had some really good contacts, so I hope you do. What I really want to talk about is, you may have had sort of presentations, what are HSNs. I just want to talk about what we do and what we might do for you. And what we're really about is to find innovations that we can get adopted at scale and at pace across our region to improve health and to improve economic benefit, whether that's to industries within the region, cost effectiveness of the delivery of health services, save the NHS money, or to improve the economic effectiveness of the population, get people into work who are otherwise unable to because of illness. And the way we do that is push and pull. Could sound a bit rude. No, I won't tonight. Push is where you guys have got an innovation, like Tom comes along with Chetware and says, why aren't you doing this across the West Midlands when the prize is as good as it was described there? So you push an innovation our way, and we work with you, if it meets our criteria and our priority areas, to get it spread at scale and at pace across the region. And unlike some other public bodies, it's explicitly within our thing that within our remit that we're not just after health gain. Your commercial success as industry and academics, or parts of the NHS that want to generate a commercial revenue stream, that's part of our agenda as well. So we want to help you to get wealth into the region, into your business or your organisation. And pull is where some of our stakeholders say, I've got a thorny problem, has anybody got an innovation that can help with that? So it could be one of our academic institutions that's looking for a research partner or an industry partner to help to commercialise, or an NHS partner to help to do a proof of solution out there in the service and prove that the effectiveness, the improvement of patient experience, to health outcomes, to well-being is really there. I've got some flow charts. You can't read them, so I'm going to ignore those. Those are just for the benefit. I'm assuming that the slides will be available to people who attend, and you probably won't be able to read them then. But my contact details are on here. If you want more detail or something flashing animated, we'll get something to you. Excellent. So, I mean, if Martin's around, I think you've got the 2-side PDF of our push-pull flowchart, and if anybody wants that, that could go out. I want to start by saying, in terms of that, what those flowcharts say is, if you have an innovation and you push it towards us, or if in response to a pull, we've got a real problem with self-harm in young people, and has anybody out there got an innovation, we want to support you if it meets our criteria. Now, we've got a set of themes and clinical priorities. I won't list them now, they're on our website. Clinical priorities at the moment are mental health, drug safety, and long-term conditions. We've also got some enabling themes, one of which is digital health, which is one of the reasons some of you are here today. And if your innovation is something that looks like it's market ready, we're not people who help you to turn an idea into a product, but if you've got something that's pretty much ready to implement either in the service or with other industry or in academia, and its rollout will really add value, we're probably going to want to get behind you. We're not a funding body, and what's more, we're not a funding body. Now, if what's missing from where you are now to your global domination is funding, well, first of all, I understand there's a rollover on the lotto next week, so I'd highly recommend that. Failing that, Susanna's just let it out the bag that she's got 2.1 billion in her pocket, so swamp her. Be nice to Susanna.
Be nice to me anyway. I can't give away that money.
So.
Because I have to work with 10%.
So if we're not a funding body, why on earth would you come to us? Well, actually, we're a partnership of academic institutions across the region, NHS bodies across the region, industry partners, and that does run the full gamut from micro, thread in a shed businesses, through digital entrepreneurs, small, medium enterprises, global pharmaceuticals and informatics and biotech and bioengineering companies. what you're missing from where you are now to become a really successful healthcare deliverer, if you're part of the NHS or the commercial healthcare service, or a digital entrepreneur, or an academic researcher who really wants to effect change on the back of your research, we can mobilise a community of champions. There are some world leaders in the West Midlands in a range of sectors and a range of organisations, most of whom we have a connection to. Some of them are on our board. We have some very prodigious theme directors. There's one over there who's our co-director for digital health. And clearly with the connections into Warwick University, the Institute for Digital Health and WMG, that's already paying dividends to some of our partners who through connections through just this one of our academic partners is starting to bear fruit. We can find you innovation partners. It's interesting, particularly in small and medium enterprises, a lot of people are struggling to try and be all things to all people. So one of the people I'm talking to at the moment has got a very good product, but actually software is a bit, and I'm going to use a technical term here, cack. So what we've done is we're introducing them to a partner who actually makes some really nice applications. And actually the weakness is a lot around graphic design, and it just looks a bit cruddy. And so our relationship with Serious Games International at the University of Coventry and their gamification experts with graphic and sound engineers could be that missing link between where you are now and the success that you want to achieve and the impact you want to have on the health of our population. It can be market access. There's one or two faces around here who, when they can find a door on the NHS to knock, they don't know who's the right person to speak to if they do get the door open. We can do that. We've got all of the major NHS organisations in the region are our partners. Our board, our advisory groups include the chief execs, finance directors, medical directors, and other nice people who could be the entry that you want for your business. And I mean, looking around, there's one or two people who now we're getting face to face with some seriously influential NHS partners that could just be that break they're looking for with their innovation. Another problem that we've often got, whether you're somebody who's a manager or a clinician in the NHS with the next new big thing, or a commercial partner, or a part of an academic institution, is who but you is saying your product's wonderful, because you would, wouldn't you? And actually through evaluation partners, not just in academic partners, but we've also got third sector partners who will give genuinely objective evaluation that can possibly overcome that NHS challenge called not invented here. Well, actually, we're in Stoke-on-Trent and we've got a different law of gravity to the rest of the region. But independent evaluation can just say, look at this, here are some facts. Some of the data that Tom just presented are the sort of things that speak to clinicians and finance directors who are often the final hurdle you need to get across. And having mentioned that we're not a funding body, we can and do help people with resourcing. And it might just be sidling up to Susanna and buying her sweeties to see if actually the EIT could be a medium to long-term route for a greater market and greater impact and benefit across the region. We have a relationship, it's a very close working relationship with the National Institute for Healthcare Research, CRN, the Clark. Senior figures from those, medical directors, chief executives, are on our board and on our advisory groups. We've got a relationship with the NHS European Office. Quick figure, it's a bit, you know, Vic Reeves says that 98.7% of statistics are made up on the spot. I've not got the exact figure, but something like 80% of European Commission health research funding in the last 2 years that came to the UK, which was also, by the way, the biggest recipient of all member states, didn't go to the NHS or industry. I think it was about 89% went to academic institutions, which I'm sure Thea would agree is a wonderful thing. But maybe there's a slice of that cake that could just grow a bit. And where I get excited is where there's a partnership between the NHS and industry and academia. And we don't care what colour the slice of the pie chart is, because that's where real funding can be drawn down and real health outcomes and wealth generation can happen. I'm sorry, I apologise for that unreservedly. There are some contact details that will go out, as well as looking after digital health with Theo and Tim Jones from the University Hospitals Birmingham. I also look after mental health. Colleagues Lucy and Andy, whose details are there. If you drop us a note, we'll let you know who leads on what. Crudely, Andy geographically looks after the north, Lucy looks after the middle, and I look after the deep south of the West Midlands. But between us, we've got very specialist expertise and connections. So drop a note to any one of us and we'll make sure the right person gets it to deal with. That's me. Thank you.